As Nigeria approaches the end of the present administration, Nigerian women are taking stock of advancements and persistent challenges in advancing women's health, rights, and achieving SDG Goal 5 on gender equality in Nigeria. Founder She Forum Africa Inimfon Etuk at a courtesy visit to the National Council on Women's Societies (NCWS) emphasized on the need for governments to address issues affecting women and girls in the month of March, which celebrates women. Co-partner in the Advocates for Women, Country Director, Pathfinder International, Dr. Amina Dorei, says the Council is a large platform for women to rally around in forging resilience in tackling the state of emergencies for women's health, especially in maternal mortality rates.
This is the month of March. It is Women's Month. It is a commemoration that spans through the month of March. And Nigeria has just gone through the general elections for the presidential and the subnational elections. In May, there will be a transition. The Buhari administration will end and new leaders will occupy office. But we are saying, as women, as girls in Nigeria, what has been the gains? What are the progress? What's the progress? What has been the gaps that are still existing for women and girls in Nigeria? And together with Pathfinder and many other organizations that are prioritizing women's issues in Nigeria, we narrowed it down to the issue of health, because we believe that health is a fundamental. If we're talking about achieving women's empowerment, whether it's economic empowerment, whether it's education, whether it is climate change, whatever the issues are, without the fundamental access and achievement that health, quality healthcare, quality access to healthcare brings to life. And at this point, it's not even about women anymore. Without healthcare, we cannot actually aspire to achieve the other elements provided by the SDGs.
Our mission is to also build lasting and trusted partnerships to strengthen the health systems and forging resilient pathways to the rights and sexual and reproductive health for everyone. Madam President, it may interest you to know that as far as we all are concerned in the health sector, we are actually in a state of emergency for women's health. And this is because just recently, an international or global report was actually launched where it is shown that between the year 2000 and 2020, that is 2020, Nigeria had the highest estimated number of maternal deaths, accounting for more than a quarter. That is about 28% of all the deaths that occurred of women actually occurred in Nigeria. And we are looking at the global figure. That is between 2020 to 2000 and 2020 in the 20-year gap. It means that Nigeria is contributing so much in the health and well-being of women. And if we fail, it means the global community has also failed. Because of our population, because of our youthful exuberance in terms of the young population, we have to really be very intentional in taking care of the health and well-being of our people. So because of that, Pathfinder International, with the support from the Bill and Melinda Gates Foundation, is actually leading the efforts of advocating and bringing all partners together, especially partners that are important in amplifying the voices of women. And because of the role that NCWS plays in amplifying the role of women, and even being in every nook and cranny of Nigeria, we believe that you're a very important partner in amplifying these voices. What we are here to present with our partners, She Forum, CCSI, and others, including Gender Links that are not here, is to say that we need to have that voice, one common voice, because we are all working towards the same goal. So we need to have that common voice to come together and say, this is what women want. This is what women need. And women, as we say, is not women in only the communities that are around, urban areas, but all the communities, including our rural communities.
Responding to the women group, the national president, National Council on Women's Societies, Haja Lam Lau, said she's convinced about grassroots women development, especially in their health, by getting the rural women educated on maternal mortality.
Health, they say, is wealth. And when you talk of women and children, the first thing you look at it, if you want to achieve anything, is their health. And I'm even more convinced or carried away by your speech when you mention of touching our women at the grassroots. You know, I always talk of grassroots because I'm a grassroots woman. I started 30 years back from the grassroots. How do we involve our rural women? How do we get our people from grassroots, educate them? You know, when you talk of maternal mortality and the rest, go to the grassroots and see what is happening. You know, we all sit down under the air condition and talk of these women, you know, as our target audience. But we don't get them educated, we don't get them informed, they don't know what is happening. So I'm very happy to receive you, my sisters, and to also assure you that National Council for Women's Societies Nigeria is ready to work with you. This is what we've been struggling for since. And if we have other voices that can contribute, you know, and give us more, what I can say, so that we carry our women along.
These women are hopeful that come the National Council meeting, more solutions will be preferred to aid the advocacy on women's health as well as put an end to maternal mortality rates in Nigeria. Annie T. Patrick, Core TV News, Abuja.